Hello and welcome to 5 and 5, the only place to get 5 valuable clinical tips you can start using ASAP in 5 short minutes. I'm your host and fellow dermatologist Gary Goldenberg, and today we're joined by my good friends Drs. Ken Temecki and Scott Deinhardt with 5 clinical tips you can use daily. Ken, let's start with you with clinical medical tips.
Fine, thanks Gary. First medical tip involves molluscum contagiosum, a very commonly encountered viral infection of the skin, affecting primarily kids, young adults, even older adults. We as dermatologists have our favorite applications, either topical use of imiquimod, 5-fluorouracil, liquid nitrogen, curettage, all of them potentially painful, uncomfortable. The literature in the last few years has shown 3 topical preparations which have really helped the treatment of molluscum contagiosum. The combination of lactic acid and salicylic acid applied twice a day, good results within a month. The topical application excuse me, of tea tree oil combined with iodine, same application, twice a day for 4 weeks, good results. But the one I really liked is courtesy of our colleagues, I think, in Turkey, and that is the use of the alkali, potassium hydroxide, exactly what we use for the identification of dermatophytes. It's a caustic alkali, can be irritating, dissolves keratin, but the twice-a-day application resolved the molluscum within a month, 80% of the time. Next tip would be tinea versicolor. Tinea versicolor is a commonly encountered fungal infection of the skin. It affects primarily younger people, we're all young, characterized by this patchy discoloration on the trunk primarily. Treatment in the old days, selenium sulfide. Today, topically, it would be ketoconazole, either as a shampoo or as a cream, not pills. Our Chinese colleagues have looked at ketoconazole versus adapalene, primarily because tretinoin has been very helpful in the use of tinea versicolor in the past. It can be somewhat irritating, but they compared adapalene versus ketoconazole, twice-a-day application for just 2 weeks, and the results were exactly the same. Comparable, good efficacy, good effectiveness, so it's an alternative to ketoconazole. Why even use it? Because it's readily available in the States. It's now non-prescription. Someone might be treating their acne with adapalene. They can now treat tinea versicolor. Next tip is bullous pemphigoid, an uncommon autoimmune blistering disease primarily seen in adults, characterized by the deposition of IgG and complement along the dermal epidermal junction, and the treatment is usually systemic corticosteroids, methotrexate, other immunosuppressants. Well, based on the fact that omalizumab, known as Xolair, is an IgE-mediated antibody, and there is occasional deposition of IgE along the dermal epidermal junction with bullous pemphigoid, as well as seen in patients serologically. This drug was used in a small study, only 6 patients, but 5 of them did well based on that IgE link with some patients with bullous pemphigoid. So think about that drug in the future for a patient with bullous pemphigoid. There is an alternative to systemic corticosteroids and other immunosuppressives.
Ken, thank you for these medical tips. Scott, let's turn to you and have some of the surgical tips today.
Yeah, I've got a couple of tips, and both of them relate to identifying skin cancer. My first one is identify the red dot basal cell. I think that my patients always want me to identify basal cell in its earliest form and sometimes its unusual forms. And I think that many clinicians aren't aware that basal cell carcinoma can present as a red dot. Now, not every red dot that you see in every patient will be a basal cell skin cancer, but it will bring your eye towards it and you'll be able to examine it more closely and find out that many of them are basal cell skin cancers.
You know, I love the red dot basal cell. Let's hear your second tip.
My second tip also concerns the recognition of basal cell skin cancer. And we know that basal cells, many of them are translucent, but you can make them more translucent by rubbing them with isopropyl alcohol. And oftentimes, as I'm examining patients, I'll rub their skin with isopropyl alcohol. It makes the basal cell more translucent, more shiny. You can see it more easily. It's a quick tip that I use every day.
I think certainly identifying skin cancer at the earliest stage is very important for all dermatologists. I want to thank Ken and Scott with these wonderful clinical tips. This is 5 and 5. Until next time.